going to demonstrate the correct technique of newborn examination. Sir, why do you think it's important a medical student should develop these skills?
Yes, medical students should learn the correct technique of examination of a newborn baby. This is a skill that they should develop during their undergraduate clinical training. Parents of a newborn baby are naturally worried and concerned to find out whether their baby is normal or not. The doctor should be competent and confident to examine the baby and to answer the concerns of the parents, and also to act accordingly if the baby is found to be abnormal. As this is an important skill, this skill is assessed regularly in pediatric clinical examinations. However, we find that students are not very comfortable when they are given a neonatal examination as a short case in their pediatric examinations. One of the reasons for this could be that they do not get enough exposure to neonatal examinations during their clinical training. So we thought a video like this would help them to learn the correct technique of examining a newborn baby.
How do medical students could use this video?
Yes, important thing I want to mention here is that this is only a teaching aid, and this will never substitute for an actual proper examination of a newborn baby. Students can use this as a guide, but they should practice this by examining more and more newborn babies during their clinical training period. However, they should not forget that babies are delicate and they should be handled with utmost care, compassion and kindness. It should always be remembered that during examinations, the students are being observed for these skills as well.
Let's go through this video now.
Introduce yourself to the mother and explain what you are going to do. Hand washing is essential as it will prevent most of the neonatal infections. Examine the child in a well-lit warm room in the presence of the mother. First, remove all clothes. This is a head-to-toe examination. This is a term well-grown baby. First, look at the obvious abnormalities like dysmorphic features, color of the baby like pallor, cyanosis and icterus. Start from the head and palpate the head to see any abnormalities like cephal hematoma. Feel the anterior front nail. It generally accommodates 2 to 3 fingers. Suture lines are also looked at this point to see whether they are abnormally separated or overlapping. Then measure the head circumference. Concentrate on the correct bony prominences, that is, occiput, temporal bone, above eyebrows. It is measured 3 times and get the highest value as the readings. Examination of eyes is important. When the head is lifted, baby opens his eyes like in a doll. Flash the torch to look for cataracts and any pupillary abnormalities. Look the size of the cornea, corneal opacities and collarbone. It is very important to note any dysmorphic features like low set ears, preauricular tag and sinuses. 1/3 of the pinna is above the line connecting external angle of the eye. Examine the mouth for cleft palate, neonatal teeth. This baby has an Epstein curve, which is of no clinical significance. Then examine the neck for thyroid lumps and sternomastoid tumor. Then turn baby to look for any spinal abnormalities like spina bifida. This baby has a Mongolian blue spot, which is a benign condition. Then start the systemic examination. Cardiovascular examination starting at chest. Look whether the baby is tachypneic with intercostal and subcostal recessions. The normal respiratory rate in a newborn is around 40 per minute. It is very important to palpate peripheral pulse, especially the femoral pulse should be looked at. Coarctation of the aorta could go undetected if you don't do so. Auscultate the heart for heart sounds and murmurs. Listen to the lungs also at this point as the baby is quiet. Abdominal examination starts from the general palpation to look for any lumps. Then palpate the liver and spleen and the palatability of the kidneys. Spleen could be just palpable, and the pole of the right kidney is also palpable in newborn. Examine the external genitalia and the anus. Examination of the nervous system include tone and reflexes. Tone is assessed by taking the baby from pull to sit position. Observe the degree of head lag you see in a normal baby. Turn the baby to the prone position like this and observe the tone. Eliciting neonatal reflexes are very important. It will indicate the neurological development of the baby. To demonstrate the palmar reflex, palmar grasp, you have to place your fingers on the palm of the baby. Keep your fingers over the cheek and observe the baby's turning the head and start to suck. Stepping reflex. Hold the baby like this and keep the baby's feet on the bed. Look at the movements of the feet. To demonstrate the Moro's reflex, take the baby off from the couch about 45 degrees and let the baby fall on your hands. And observe the symmetrical movements of the legs. It is important that all babies have their hip examined to exclude developmental dysplasia of the hip joint. The procedure we do here is Ortolanis and Barlow's technique. The baby should be in a a supine position and should be on the flat surface. Gently grasp the flexed knees on the side of the hip you want to examine. The pelvis is fixed with the other hand. The thumb of the examining finger is placed over the femoral head and finger is placed over the greater trochanter. Then abduct the hip gently to about 45 degrees and then gently rock back and forth. If you feel a clunk, that hip is dislocated.